Welcome to the Golden State Media Concepts, America's Still Beautiful podcast, a weekly news podcast covering all the top positive and uplifting news stories. Are you tired of the same old news? Are you sick of the seemingly endless political spin and negativity? We cover stories that will inspire, uplift, and remind you of the good in the world. Tune into the Golden State Media Concepts, America's Still Beautiful podcast to get all the great and positive news stories of today.
Welcome to GSMC, America's Still Beautiful podcast, brought to you by the GSMC Podcast Network. I am your host, Alyssa Joe. Hello. How's it going today? Hope you're having a wonderful day like usual. I'm back with some more feel-good, positive stories to cheer up your day or just put a smile on your face. I've got some pretty good ones today, so why don't we just jump right into it? My first story is about quite the dynamic duo. A dog and its owner are doing something pretty incredible. So they're handing out hero healing kits to hospital workers that are on the front lines right now. So let me rewind, give you a little bit of a backstory. So Loki is the Rottweiler and his owner Caroline. They're quite familiar faces at the University of Maryland School of Medicine in Baltimore. Loki has quite a friendly reputation with all the hospital staffers and patients, and Caroline is actually a second-year med student. She was, though, pulled off of the hospital front lines after all of the coronavirus outbreaks. So she didn't want to spend her time in quarantine just doing nothing, twiddling her thumbs. So she decided to come up with a new way to help her hospital community. And this is what she came up with. It's pretty interesting. So they decided to have some conversations virtually with some of the staffers. And then she found the inspiration for a new project. And this was after she kind of realized the physical toll that the protective medical gear had on all the healthcare workers. Since everyone is, you have to wear gloves and face masks around the clock. I guess a lot of nurses and doctors have been developing rashes and skin irritation just from the constant friction of always wearing that, right? I can't imagine. That's probably not very comfortable. So she took it to her social media to look for some donations because she wanted to make hero healing kits. So these kits include skin lotion, boxes of tea, baby powder, chapstick, chewing gum, and just moisturizer for all of the healthcare workers. So not very long, I guess she put it up on her Amazon wish list to raise thousands of dollars, and she ended up collecting a lot of money with just like gift donations and stuff. So she says, so far we have raised over 1,400 kits, but we are closer to 1,600 incomplete kits. So they're just kind of building them up. She says the donations keep coming in. Needless to say, we are blown away by kindness and generosity of people. So the internet campaign has kind of helped fuel that for them. And then they're also launching hero healing kit initiatives in different cities that people have caught on to this, and they decided to continue it in different cities. So that's pretty cool. I think it's a good idea. So she says that we'll be distributing the majority of these to 4 different hospitals over the next week. And that is just the beginning. She says the hope was people would see that we are trying to do and be inspired to do the same in their respective areas, and that has happened. So we have inspired others to do similar projects in New Jersey, North Carolina, Pennsylvania, other parts of Maryland. She says this was the dream, and it's coming to fruition. Not only to help frontline workers and first responders, but to inspire others to do the same in their communities, states, and for their respective hospitals. Thank you again for all the love and support shown through all of this. We wanted to show our people keeping us safe some love, and because of you, we have been able to do that. I love all the creative ways that people have been doing this, and Loki the Rottweiler has been showing up to different hospitals and bringing like care packages. So they also get like a little surprise from Loki the Rottweiler, who's pretty cute. So it brings a little bit of a smile and some just joy to their day. Plus, of course, the healing kit. My next story is about also helping the frontline workers during this time. Sam's Club is offering hero shopping hours to all healthcare workers regardless of memberships right now. So they wanted just to show their extra support to all the healthcare workers and first responders during this time, and they've announced that they're offering exclusive hero shopping hours to all medical employees. Doesn't matter their membership status. So currently, the company employees are given an exclusive 2-hour block of shopping time in the morning from 8 to 10 a.m. on Sunday mornings. But starting right away here, they are now doing hero hours, which will also be open to healthcare workers for free. They get complimentary face masks will also be provided to shoppers at the door, so that's pretty cool. The company says that they were inspired to launch this initiative after several individual branch managers took it upon themselves to invite local hospital workers to shop with the store associates. It says Mr. Sam once said that the best ideas come from our associates, and we believe this to be true now more than ever. Previously, a few of our clubs invited healthcare workers and first responders for early shopping hours with our associates. It's inspiring to watch the ways our associates serve those around them. We're following the lead of those thoughtful clubs by expanding the audience for this shopping period to include healthcare workers and first responders. So there you have it. They're opening up I believe it's 8 to 10 a.m. every Sunday, and you can go in there if you're a healthcare worker for free. Doesn't matter your membership, and you can shop just for you. My next story is about a musician from Huntington Beach, California, and he's kind of created something pretty cool to help entertain his friends that are in quarantine and just his community around him. So he is a musician, and him and his family decided to decorate the truck. He has a truck, and he's literally playing the guitar and singing, so putting on a full-on performance in the bed of the truck. It's pretty cool. His name's Tanner Howe, and they just said him and his family just got tired from sitting at the house, looking at each other, just not doing much. So they decided to surprise some of their close friends and put together a show. So he is a singer-songwriter from Huntington Beach, California, and they just decided to put a list of songs together. They decorated the truck, and then they brought cameras to record different reactions, and then, of course, while maintaining the safe social distance, and they're wearing masks. So it's pretty cool. It says initially that they were planning just to visit grandparents in Long Beach and some few other family members and some friends, but then they decided to stop and play for different neighbors and hoping that it would just brighten people's day. So there was a video, of course, and it went up on the internet and went viral because it's just pretty cool. He just literally drives around in his truck while he's playing in the back, and one of his family members are driving in the truck, driving him around, and it's just like a mobile concert to entertain people that are in quarantine and in their house, and of course it entertains them as well. But there is a video online, and it's pretty cool the way that they decorated the truck, and it's just like a full-on, almost like a parade by himself. It's a little mini parade putting on a quarantine show. All right, another pretty cool thing that's happening in our world right now is a nonprofit company called COVID Tech Connect, CTC, and they are asking tech manufacturers to donate Wi-Fi enabled devices for hospital patients so that they can video chat with their loved ones while they are undergoing medical treatment. Since obviously no visiting or anything is going on, they're only visited a few times occasionally by doctors and nurses. It's very difficult, of course, to be in a hospital by yourself. Your family can't really come see you and support, and just having that's a pretty big challenge, and not everyone has the devices to be able to connect with their friends and family online and virtually, right? So this nonprofit organization, COVID Tech Connect, wanted to just their goal is to collect 20,000 donated devices and spread them amongst different hospitals and just places that need them, people that need them to be connected with their family. So they do have a website, CTC, and they explain that hospitals are no longer admitting family members and friends, of course, just due to the demand on services and the risk of getting the diseases. You can't really go in and visit your friends and family in the hospital if you have people in. So, they decided to come up with this idea to collect all these donated devices to make sure everyone is connected. So it's a pretty cool. Sarah Rodell is the CEO of technology logistics company Loop and Tie, and she heard that people in New York Nurses Union were trying to organize donations of just smart devices so that family members could stay a part of it during all this chaos. So she was really just touched by the thought of it, and she reached out to a different team, just lots of different people and experience in the logistics and technology solutions, all those kind of things. And she reached out and was able to connect with some people and get some devices. So she kind of organized this whole thing. It's a headquarters of over 1,000 miles away in Texas, but it's helping receive donations and distribute orders of devices to hospitals and just kind of managing the shipping and handling. She says we have over 3,000 devices committed and more conversations are underway to get us to the goal. We've received some great responses from partners willing to donate devices, including Microsoft, PC Wireless, Presto, and then just a bunch of other announcements coming. So they've also set up a GoFundMe campaign, and it was only launched 10 days ago, but they've already raised over $100,000. So it's making a really big difference in people's lives so far, and it's just going to continue to keep growing. It's definitely important to stay connected with friends and family during this time, especially if you're in the hospital and you can't be there with them. All right, that is all my stories that I have for you right now, but when we get back, I have more feel-good stories to perk your day up, so stay tuned.
The GSMC Life and Happiness podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back to GSMC, America's Still Beautiful podcast, brought to you by the GSMC Podcast Network. Okay, so we are back. I thought I would change things up a little bit and give you a story that has nothing to do with the pandemic. There's a pretty cool research that came out, and I just wanted to share it with you. So it's been several years of researching. These researchers have been trying to look into 4 different coal-fired power plants, and scientists have found that local residents experienced fewer asthma symptoms and related hospitalizations as the plants either retired coal as their energy source or installed stricter emissions control. So adding on to that, the emergency department visits dropped dramatically along with a decrease in coal usage. So they're saying that if the coal usage declines, there's a dramatic decrease in asthma symptoms, hospitalizations, anything related to that. So the research was conducted in Louisville, Kentucky, and it was published this week by the Columbia University Mailman School of Public Health in collaboration with several other universities and research institutions. It's been going on for quite some time. So back in 2012, the city of Louisville embarked on a project called Air Louisville. So this basically they wanted to use data from Propeller Health digital inhaler sensors to gain insights into the impact of local air quality on the burden of respiratory disease in the community. So the public-private collaboration equipped more than 1,200 Louisville residents with asthma and COPD with propeller sensors, which attach to patients' existing inhalers, and it just basically gives you information, the insights of medical use, symptoms, environment factors, and it's all connected to this Propeller app on their smartphone, which is pretty cool. But they're saying that coal-fired power plants are known, of course, to emit pollutions associated with adverse health effects, as we all know, with asthma attacks, asthma-related just emergency things, right? Visits, hospitalizations. So in 2014, coal-fired plants accounted for 63% of economy-wide emissions of sulfur dioxide in the U.S. So Kentucky has ranked among the top 5 states in the U.S. for emissions from power generation. So the Louisville mayor, Greg Fisher, says Air Louisville brought together local government, public and private partners, and residents for a common mission: to leverage local data to make our city better and more breathable. We are still seeing the results of Air Louisville on this research, which demonstrates the public health impact of retiring coal as an energy source or further controlling coal-fired emissions. Now, more of a timeline for you. So between 2013 and 2016, one coal-fired plant in Louisville area retired coal as the energy source, and 3 others installed more strict emission controls to comply with the regulations from the U.S. Environmental Protection Agencies. And the researchers took advantage of these circumstances just to analyze the impact of the coal-fired power plant transitions on residents' respiratory health. And then using all of this data from the propeller and local hospitals to just kind of come up with the data. So the study looked at the frequency of the total number of asthma-related emergency device visits and hospitalizations per zip code, as well as the frequency of asthma rescue medication used amongst 207 people. And then data on rescue medication used for asthma was used as a proxy for patients' symptoms, as patients use their rescue medication for acute relief from symptoms such as, coughing and shortness of breath. So Dr. Joan Casey was the lead author of the paper and assistant professor of environmental health scientists at Columbia University Mailman School of Public Health. And Dr. Joan Casey says the study was unique in its ability to measure asthma morbidity based on both hospitalizations and daily symptoms, and to leverage an abrupt change in environment exposure to more directly attribute changes in asthma exacerbation to changes in coal-fired power plant emissions. So the researchers found that energy transitions in the spring of 2015 resulted in 3 fewer hospitalizations, NED visits per zip code per quarter in the following year. And then when comparing areas that had high coal-fired power plant emissions exposure prior to transition to those with lower levels. So this all translates into nearly 400 avoided hospitalizations, NED visits each year across Jefferson County. Quite a lot. 400 avoided hospitalizations. It's still quite a bit, right? So at the individual level, they say that the Mill Creek SO2 scrubber installed that was back in 2016 was associated a 17% immediate reduction in rescue medication use, which was maintained thereafter, they say. And then the study also found the odds of having high rescue use throughout a month was reduced by 32% following June 2016 energy transition. So they say that this is the first study to use digital inhaler sensors to understand the health effects of reducing emissions from coal-fired power plants. We hope this evidence will encourage government officials to support stricter standards when regulating coal-fired power plants and encourage us towards cleaner power options, thereby, of course, protecting the health of people who live near these facilities. Since we are on a scientific roll of new discoveries, I thought I would continue with a newly developed solar cell that earns 2 world records for its efficiency. Pretty incredible. So scientists at the National Renewable Energy Laboratory, the NREL, have fabricated a solar cell with efficiency of nearly 50%. So here we go. The average solar cell has an efficiency rate of 15 to 20%, meaning it's capable of converting just a small fraction of absorbed sunlight into electricity. So now the newly developed 6-junction solar cell holds the world record for highest solar conversion efficiency at 47.1%, which was measured under concentrated illumination. A variation of the same cell also has efficiency record under one sun illumination at 39.2%. Pretty cool. So John Gies is the principal scientist in the high efficiency crystalline photovoltaics group at NREL, and he's also the lead author of the new paper on the record-setting cell, and he says this device really demonstrates the extraordinary potential of multi-junction solar cells. So this device contains about 140 total layers of various materials to support the performance of these junctions, but it's actually 3 times narrower than a human hair. So due to their highly efficient nature and costs that are associated with these solar cells, they're most often used in power satellites. But on Earth, this cell is well suited for use in concentrator photovoltaics. He says one way to reduce cost is to reduce the required area. And you can do that by using a mirror to capture the light and focus the light down to point. Then you can get away with a hundredth or even a thousandth of the material compared to a flat plate silicone cell. Use a lot less semiconductor material by concentrating the light. An additional advantage is that the efficiency goes up as you concentrate the light. Pretty cool. So they described the potential for the solar cell to exceed 50% efficiency as actually very achievable. But that 100% efficiency cannot be reached due to the fundamental limits imposed by thermodynamics. But currently the main research hurdle is just to get over that 50% efficiency to reduce the resistive barriers inside the cell that impede the flow current. So they're still working away, but this is a pretty cool discovery that it looks pretty promising. Now, that's all that I have for you right now on the new discoveries that are happening in our world. When we get back, I have some more feel-good stories for you. A little bit about anxiety and handling all of that right now, what researchers are saying that you should be doing, and just some more feel-good stories to cheer up your day. So stay tuned.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter and download us on iTunes, SoundCloud, and Google Play.
Welcome back to GSMC, America's Still Beautiful podcast. Okay, so I said I had some story about anxiety from some researchers. So there was a new study that says when you're feeling particularly stressed or anxious, you should be playing Tetris. And of course, these times are extra stressful and anxious for so many people, everything going on. But this study says that there is a very simple and very fun way to ease your worried mind, and that is by playing Tetris. So this research came from the University of California, and I guess Tetris has a remarkable effect on a person's mental health and performance. Who would have thought? So the psychologist, Kate Sweeney, she led this research by studying the game's effects on the welfare of the university's student population during times of immense stress, such as like undergoing just exams and university things, of course, considering future careers, all these things. So she instructed the students to play the game before measuring their relative levels of anxiety. So her research shows that playing Tetris, overworked individuals often experience a significant reduction in stress and anxiety and an influx in positive emotions. So you're probably thinking, maybe I can just play a different type of video game or something like that. And she does say that other video games offer similar kinds of distraction and help, but I guess Tetris offers a really good balance of challenge and accessibility. It's difficult enough to keep players engaged, but simple and intuitive enough to allow players to stay relaxed and enjoy the experience. So I guess the specific mental state is referred to as flow, or being in the zone. So she says, flow requires a delicate balance. Flow is mostly readily achieved with activities that challenge the person somewhat, but not too much, have a clear, achievable goals, and that provide the person with feedback about how they're doing along the way. So I guess this is not the first study that has shown more benefits of Tetris. There was a 2009 study that showed people who played Tetris over time experienced improved mental performance. So it makes it just kind of the perfect activity for distraction, just to have some fun, release some stress, and play a fun game. She says the Tetris study is key because it experimentally manipulates flow and shows effects of that manipulation, which provides convincing evidence that flow actually causes well-being during waiting periods, not that it just happens to coincide with well-being. So there you go. Next time you're feeling stressed or anxious, I just gave you a new quarantine activity to do, and play Tetris and feel calm. Go into your zone, your flow. My next story is about a customer at a bakery. I guess the customer is quite the regular, but this is a small family-owned bakery, and this customer just wanted to help them during this time, and they spent $1,000 on a single donut. Yes, $1,000 single donut just to help out. So this is a donut shop in Ohio. So it's called Tremont Goodie Shop in Upper Arlington. And yeah, this customer paid $1,000 for a single custard donut for takeout. Pretty cool. I guess this customer is a regular and has been coming in anywhere from 40 to 50 years. And he's always been just random acts of kindness and just always been doing random little acts here and there, and it's just always been kind. So I guess this $1,000 is just really gonna actually help keep this small company in business right now. So one of the owners says, "We are in tears. This is a custard donut for $1,000 to help keep us in business. What a blessing." So they posted this up on Facebook along with a photo of just kind of the customer holding the donut. So Emily Smith is the manager of this bakery, and I guess she was just absolutely speechless. She says, "He called and asked us if it would be okay to give us $1,000 for his donut." She says, "I got choked up, and he asked again, would that be okay? Because I guess there was silence on the line." She says, "I choked out, yes, of course, it would be okay. I never expected that." So the customer who, has done random acts of kindness in the past, but definitely not paid $1,000 for a donut. So I guess before this, he hadn't been coming to the donut shop, to the bakery very often, because he said he was trying to lose some weight. And so he was, staying off the sweets as much as he could. So he wasn't in as much, but realized, when all of the coronavirus pandemic hit, a lot of, the income would have been gone for this bakery, so he wanted to help. He said, "I really just wanted to support you." She says he's the kind of guy that just lights up the room when he's there. So they posted this on Facebook, and of course it went viral, and there's all these things about it. And says, "This is just absolutely amazing. I'm so grateful for folks who can do something like that. Can't think of a better business to support." That was just one of the comments on the Facebook post. Another was, "Love this. We will be making our weekly order again this week. Just ate our last soft chocolate chip cookie." Another one, "Yes, I love this goodie shop so much." So people are showing so much love for the bakery to begin with. But the bakery itself, the family-owned shop, is just very happy that they were able to help keep their doors open with like that. Another one of the employees says that someone left a $100 tip the other day, which is just such a blessing. My next story is about a 99-year-old World War II veteran, and he did something pretty amazing. He raised $3.3 million for hospital workers by walking laps in his garden. Pretty cool. So he's an English World War II veteran, and yeah, he's literally been walking laps around his garden, raised $3.3 million for the NHS just in 1 week. His name is Tom Moore, and he says that the NHS has been marvelous in helping him recover from his hip replacement and skin cancer on his head over the last couple years. He says, as a way of saying thank you, he wanted to do his daily laps of 25-meter-long garden with the aim of walking 100 lengths by his 100th birthday on April 30th. And he decided to do this. He started this on April 6th. So his daughter helped him set up this fundraising campaign, and just to get donations for what he was doing. And, originally he did not expect to raise anywhere near $3 million. But I guess the donations just kept flooding in because his story made the headlines and people just started donating, and all of a sudden he was raising over millions for all front health line workers that are fighting the coronavirus right now. So he says, I thank the British public from the bottom of my heart. It's difficult to imagine all these kind people who have donated so far. It's just amazing. So, yeah, then his daughter took to Twitter and said, we are overwhelmed by the response. It's extraordinary. So he's way past his original goal, but he's hoping to complete another 100 laps of his yard just to continue raising money for the NHS, and just to support different charity efforts and all these things. So you can go to the crowdfunding page. It's called Just Giving crowdfunding page, and you can donate to his fund if you like. $3.3 million. It's a lot of walking at 99 years old. Okay, I have one last story for you today, and I think all you animal lovers are going to especially love this one. It's pretty cool. So, dogs are now joining the fight against COVID-19 by learning to sniff out the virus. How crazy is that? Of course, we know that dogs for many years have been helping, sniff out narcotics, explosive devices, pests, natural disasters, even cancer, Parkinson's disease. But now they are training some dogs to sniff out coronavirus. So there's a medical charity in England, and they had successfully trained dogs to detect malaria. So now they're trying to train dogs to identify the smell of COVID-19. Pretty insane. The charity, it's called Medical Detection Dogs, and they're partnering with Tropical Medicine and Hygiene School in London, along with the Durham University, to begin training dogs for this specific job. Pretty insane. They're saying that they're describing this approach as rigorously scientific. Medical Detection Dogs has produced more than a dozen peer-reviewed papers during their work training dogs to smell and detect cancer, Parkinson's disease, and then most recently malaria. So now they want to come together and try to figure it out so they can sniff COVID-19. So one of the scientists says the aim is that dogs will be able to screen anyone, including those who are asymptomatic, and tell us whether they need to be tested. This would be fast, effective, and non-invasive, and make sure the limited NHS testing resources are only used where they are really needed. Crazy. So we all know that other respiratory diseases like COVID-19 change your body odor. So there's a very high chance that dogs actually will be able to detect it, I guess. So there's this new diagnostic tool that could really revolutionize our response to COVID-19. All right, that is all the stories I have to share with you today. Thank you so much for listening to today's episode of GSMC America's Still Beautiful podcast, brought to you by the GSMC Podcast Network. I am your host, Alyssa Joe. Thank you so much for being here. I appreciate you listening. I hope I gave you a smile to your face during this crazy time. Please do not forget to hit that subscribe button, to like and follow us on social media, and leave a 5-star review. It's always greatly appreciated, and I look forward to sharing more great stories with you next time. Stay healthy and stay positive. Till next time, thank you.
You've been listening to the Golden State Media Concepts, America's Still Beautiful podcast, part of the GSMC Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcasts on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type in GSMC to find all of our shows. From the GSMC Podcast Network, from social media news to marketing news and and even weird news. The GSMC Podcast Network has you covered. You can also follow us on Twitter and Facebook. Thank you, and we hope you have enjoyed today's episode of the Golden State Media Concepts, America's Still Beautiful podcast.